Hello, I'm going to be talking about HIV and AIDS. So, to start, what is the difference between HIV and AIDS? HIV is the beginning stages of AIDS, and AIDS is the ending stage of HIV. So, HIV is a disease that attacks the immune system. So, not only does it make you have a weakened immune system, but it makes you immunocompromised, so you are able to get other diseases easier. So where did HIV originate? It came from Central Africa in the 1800s. So a long time ago. We hunted chimpanzees in Central Africa, and while harvesting the animal, we got the HIV virus from the blood. So that is how it transferred to humans. But we did not start having a spike in the United States until the mid to late 1970s. So that's when it started to get popular, if you will, here in the United States. So HIV comes in three stages. Comes in two, really. It comes in stage 1, which is the acute stage, and then stage 2, which is the chronic, and then your third stage is going to be when it turns into AIDS. So, we get HIV from, most commonly you hear that we get HIV from unprotected sex, which is true, but you can also just get it from coming in contact with bodily fluids, but it is just most commonly said unprotected sex because that's how you usually come into contact with bodily fluids from a infected person. So starting with stage 1 of HIV, it is the acute stage, as I had said, and you are super, super contagious in this stage. This is when you have one of the highest counts of HIV in your blood level, and you are mostly experiencing a flu-like symptoms. It's very common for you to start experiencing flu-like symptoms 2 to 4 weeks after you contract the virus, and then usually have these symptoms within these, like a 2-week period. Then once you move to stage 2, which is the chronic stage, you're still contagious, but you have a lower count of HIV cells in your blood. This stage can last a super long time. It can last up to a decade. You could be stuck in this stage. It can also be treated in this stage. So usually people find out they have HIV during the chronic stage, and usually it can be controlled with medication so that you don't ever move into the stage of AIDS. You are mostly asymptomatic in this stage as well. So that's why most people find out in the acute stage, okay, I'm experiencing symptoms. Stage 2, they get treated. They don't experience as many symptoms. If you are on medication and you move on to stage 3, which is AIDS, then you have a very short life expectancy. This is, of course, left untreated completely. After contracting AIDS fully, your life expectancy after that is up to 3 years. That's what most of my research said anyways. And also in stage 3, you're also highly contagious as well. So it kind of fluctuates. Stage 1, you're super high in count. Stage 2, it kind of mellows out. And then stage 3 is when it starts picking back up again. You are also very, very infectious in this stage. The symptoms for HIV and AIDS are fever, chills. You can have muscle aches, fatigue, swollen lymph nodes. So these are all different symptoms, but as I had said previously, one of the big telltale signs of HIV and AIDS is, or when people get tested rather, is when you have that 2 to 4 week period after contracting the virus of having the flu-like symptoms. So, treatments for HIV and AIDS. So there's no cure for this disease, but there are treatment options. The medication is it's called ART, and I can never figure out how to pronounce it, but I think it's antiretroviral. Yes, antiretroviral therapy, and this medication prevents transmitting. There are also medication options that are like there's a pre, so like a pre and a post exposure. So you can take while taking. This is for like the other person also, so you can take a pre and post exposure medication as well. There are also, I was going to talk about testing, because that was a big thing in my research as well. So, testing for HIV and AIDS, there's also there are 3 different tests. There's an antigen, an antibody, and then a NATS test, which is the nucleic acids. They're all, okay, so they're usually, blood drawing, the action, blood drawing tests, so they're just different in the fact of, like, what you're testing for. So, antigen, obviously, antibody, nucleic acid. The NATS test is just testing for the virus itself in the blood. So that is the difference in the testing. So once tested, everyone gets treatment options, and these medications prevent you from transmitting the disease. Thank you.